joining us for this month's Strengthening Families Networking webinar. Today we're going to hear from West Virginia, where the Strengthening Families Initiative has been using mini grants for the last 3 years to get some implementation going in innovative ways in communities and programs. So before we get to that topic, we've got some housekeeping and some updates from my organization, the Center for the Study of Social Policy, and from the National Alliance of Children's Trust and Prevention Funds. So I'm going to jump right into that. That's me. I'm Kaylin O'Connor from CSSP. Wanted to make sure everyone on the line knows that we hold these networking webinars each month. It's an open invitation to anyone who's using the Protective Factors Framework or coordinating Strengthening Families efforts, jointly convened by my organization and by the National Alliance. And we have a topic each month. You are always welcome to join when the topic is of interest to you, and skip it if it's not of interest to you in your particular work, and also to invite others when the topic looks like it's particularly relevant for them. We welcome anyone to join us each month. All the recordings and materials from past webinars are posted on a Google site that is maintained by the National Alliance of Children's Trust and Prevention Funds. At this point, it is quite a treasure trove of recordings and PowerPoint slides and handouts from years of these webinars, and so I encourage you to check that out. Today's webinar materials will be posted there in the next few days once we get them all processed. So always check there, particularly if you missed the webinar, but also if you're just looking for information on a particular topic, it may have been covered in a previous webinar. So as I said, we do these each month. Usually we do them on the second Thursday. We're throwing everyone for a loop on April. We're going to do on April 6th. We will do it the first Thursday of the month just because of some scheduling conflicts among myself and the presenters. So we'll be doing that April 6th. Other than that, it's always on the second Thursday. In April, we're going to hear from Washington State's Corrections Department. They have a parenting alternative program that builds parents' protective factors, and there's actually a short film coming out through the Federal Office of Child Abuse and Neglect. They have a series of films about different strategies for prevention being used in communities and states, and this is a great one. So we're going to show a preview of the film on that webinar, and it will be available that day for those of you who would like to go then watch the full film. So you can register for that already. The link is there on your screen. But you will also see the Strengthening Families e-update newsletter that comes out towards the end of March. We'll have the link to register for April. And then in May, we're going to hear from our friends in Idaho, Maureen Vernon and Jane Zink. Many of you are familiar with the previous training materials that they've developed, the toolbox training. They continue to offer that, but they've also put together a new book of training resources that I think many of you will be able to apply to whatever kinds of trainings you do Strengthening Families, whether you're training professionals or parents, whether you're using a set curriculum or not. These can be some activities and lesson plans that you can build in to your trainings. And so they're going to talk about that book in May, and it will be available for purchase soon after that. Or maybe before that. I could be misspeaking there, but I know it's coming out around that time. So we'll have that registration information ready in April. And mark your calendars for those second Thursdays coming up, and we'll let you know the topics as we go. A couple of webinar tips. If you're ever having trouble with your audio connection, the best tip is to switch from phone to computer or from computer to phone, whatever's not working. The other one might work better. And then if you want to be able to speak, you always need to let the system know whether you're on telephone or mic and speakers. So on your panel, it looks something like this. And if you're using your phone, you'll have something called an audio pin that you need to enter if you want us to be able to unmute you when you have a comment. If you're having trouble with the webinar system, feel free to type in a question, and we will get back to you as quickly as we can. Throughout the webinar today, if you have any questions or thoughts that you'd like to add into the conversation, you can always type them into the question box, or you can raise your hand. That's a symbol that looks like this, depending on the webinar, how you're accessing the webinar. It's something like a little hand. You can raise that, and then we can unmute you so that you can ask your question. And we really hope to get some discussion going today about how others maybe have used mini grants or questions you have about how West Virginia has done it. And we encourage you to do either way, typing or speaking, whatever is more comfortable for you. Okay, I've got a couple updates to share from CSSP. We have had a series of taking care of yourself handouts, and recently had a request from someone who was looking to use one for early care and education providers. They were asking whether the one that we had written previously for home visitors would apply. And I looked at it and I thought, well, it doesn't quite. So let's make some modifications. It's not hugely different, but it does directly address some of how early care and education providers may want to think about their own protective factors at the same time that they think about the protective factors for the families they work with. This is part of a series that actually started with one for child welfare workers and one for foster parents. And as you'll see, we've expanded from there. So on the professional side, we now have for child welfare workers, for home visitors, and for early care and education providers. And on the parent side, we have one for foster and resource parents, and then one that's specifically for kinship care providers, because we realize that there are other considerations that come into play about the whole extended family and the relationship with the children's birth parents that are a little bit different with kinship care providers, and we wanted that group to feel like this really spoke to them. I will say the professional ones are just 2 pages, sort of front and back kind of handout you can use. The ones for foster and resource parents and kinship care providers are longer. It's a page about each protective factor, which sort of defines the protective factor, explains how some of the questions you might want to ask yourself about how you're staying strong in this way, and then some trauma tips, so ways to help understand why parenting a child who's been through trauma is different from what you may have done before, and really hopefully gives people some good insight both into their own well-being as they're taking care of children and into some of what they're experiencing with the child in their care. So you can find all of those on our website. I know our website can be a bit overwhelming at times, so if you go to strengtheningfamilies.net or if you go to cssp.org and go into the Strengthening Families section from the main menu, just go under the Systems tab within Strengthening Families, and then you can expand the system that you're interested in, whether it's home visiting, child welfare, or early care and education, and find the self-care tips there. A couple of other things going on at CSSP. We've just launched a new blog series about early childhood systems. So really trying to look at what's happening at the community level to promote healthy child development and support families. And our first blog post is written by Joan Lombardi, who has been a leader in the early childhood field for years, and we're very happy that she is currently doing some work with us at CSSP. I think she's a senior fellow, I'm not sure of the title, but we are very thrilled to have her joining our staff on a part-time basis and sharing her thoughts on what can happen to build communities where young children and families can thrive. If you stay tuned to our website or to our newsletters, you will see more of those blog posts coming out over the coming weeks and months. The other thing that we've been doing at CSSP in light of the new administration is that we have been preparing issue briefs that respond to some of the proposed legislation and executive orders as they come out. So just this week we released 3 issue briefs related to the proposed healthcare legislation, which as we know is all it's very much in flux where it will land. But we focus on the communities that are most vulnerable to these changes and talk about what some of the implications of these proposals. So you'll see the titles here and the covers. I encourage you to, if you actually just go to cssp.org, these are all right on the front page along the right side, the most recent resources. And these are focusing on the populations that we focus on in general, so young children and their families in general. And there's one about children, youth, and families involved with child welfare and what the Medicaid changes could mean for them. And then we talk about Medicaid opportunities for child welfare involved expectant and parenting youth and their children. So a very specific population, but if you work at all with that population, I really encourage you to check out the issue brief and let us know what you think about them. Related to that, we had a couple things that came out in February. One about safe spaces for immigrant children and families, so really looking at what the immigration rules and refugee rules and their enforcement, what effect that will have on children and families, and what cities and community leaders can do to help create safe spaces for these vulnerable families. And then one about now is the time to get real. So Get Real is our initiative focused on LGBTQ youth. REAL stands for Recognize, Engage, Affirm, and Love. Most of that work is focused on LGBTQ youth who are involved in foster care, but also extends into children who are not in the foster care system but who identify in this way. So that was just a blog post by one of my colleagues, Bill Betancourt, but again, a response to some of the recent executive orders and legislation. And if those are groups that you work with or issues you're interested in, I hope you will read and share those resources. That's all I have to share from CSSP. I'm going to hand off to my colleague Martha Reeder at the National Alliance of Children's Trust and Prevention Fund.
Thank you, Kaylin, and it's good to be with everyone this afternoon. Can we go to the next slide, Kaylin? The Alliance National Parent Partnership Council launched a series of infographics last summer, and you have probably had these in your possession, and you can download these from the Alliance website. And the first one in this series was on parental resilience. The council is now working on the one for social connections. One of the things that's very unique that they have done is on the front side of the infographic, there will be some basic definitions and then a list of the everyday actions from the logic model. And in the blue section that you're seeing, there are at least one or two examples for each one of the everyday actions of very concrete things that parents have been implementing in their own lives to help build protective factors through these everyday actions. One of the ways that the council has gathered this information is to create a survey which contains the questions that they brainstorm from each one of these everyday actions. And so, for instance, if the everyday action is to demonstrate in multiple ways that parents are valued, there was a lot of conversation among the parents about how could you get other parents to share how they have observed that in the settings that they bring their children to, in their community, and all sorts of other ways. And so the questions are each attached to those everyday actions. If you can go to the next slide. On the back side of this infographic is really just a collection of all sorts of parent translations from different organizations, states, and agencies from across the country about ways that they're paraphrasing and communicating about that particular protective factor. Let's go to the next slide. As I was explaining to you that they're working on the social connections one right now, and you can see these are the everyday actions for social connections. And all the questions in the survey are generated from those everyday actions. Let's look at the next slide. So what I would really love for each one of you to do is to circulate this link with organizations that you know that work with parents and with parents themselves that you might work with. And finally, you might just put on your parent hat and take the survey yourself if you think that you have really great ideas about how you're implementing those protective factors and those everyday actions to build protective factors in your life. So we're very interested in hearing what parents are saying about how they're actually already doing this in their lives. And then we'll be very excited to share that back with you in, as soon as possible. And we'll be continuing. We've already started the next one, which will be on knowledge of parenting and child development. Okay, just a little update about the Alliance Certified Trainers with our training of trainers bringing the protective factors framework to life in your work. We just delivered a training in Oklahoma, and we have now 649 certified trainers across the country. A really exciting group that we shared with in Oklahoma. And the next slide will just give you some information about upcoming trainings for this coming summer. We'll be in Sacramento, California, April 10 through 12, in Medford, Oregon, May 23rd through 25th, in Petoskey, Michigan, May 31st through June 2nd, and in Denver, Colorado, the week of June 12th. We're still firming up the exact dates on that. So if you have any questions or you know people on your staff that might be interested in becoming a certified trainer for our training, do contact me and I can give you further information. Now I have something that is particularly exciting to me. At the Alliance, we have been working together with Children's Bureau to create a very unique and short training, but very hard-hitting, about preventing child neglect. A lot of this work is based on the research that already has been done as part of the work the body of work we have at the Alliance, and we have many great resources already on our website, and you can go there at www.cdfalliance and find many of those things that are already there. This training will have 4 short parts to it, and if we go to the next slide, basically those 4 parts will be that we will look at the basics about preventing child neglect, basic things like what is the definition, what are the different kinds of neglect that we're talking about. Then we'll look at ways that our assumptions could possibly be wrong, and what we perceive as being fact and what we perceive as being fiction around this topic. And then the third section will really help us understand more about how preventing child neglect is everyone's responsibility. And the last section will give us some very concrete strategies about what everyone can do to help prevent child neglect. Let's look at the last slide, please. This really is possible through a partnership with the Child Abuse and Neglect Technical Assistance and Strategic Dissemination Center of the Children's Bureau, and we hope that we'll be releasing this sometime in the next couple of months, and it's going to be a very exciting training. We'll have some guidance that goes with it and some very unusual and unique learning tools and interactive and fun learning tools that I think will be something that you may not have seen before, and we're really excited to be able to share this information with you, and hope that you will keep in tune, and we will have more information as soon as we're able to. Thank you.
Thanks, Martha. I'm so excited that project is moving along. I'm very excited to see it, as I'm sure many other people on the line are. Okay, we are going to, thank you. We're going to move into our topic of the day, which is about these community mini grants in West Virginia. And with us today we have Jeanette Rousey, who's the project coordinator for Strengthening Families West Virginia, and Beth Elliard from the United Way of Monongalia and Preston Counties. I apologize if I mispronounced the name. I should have checked that in advance. And Jim McKay was going to be on the call as well, but he had a situation come up and was unexpectedly unable to join us. So I know that Jeanette and Beth will still do a great job of representing the work that's been going on there, and Jim had hoped to be part of it because he's also very proud of what they've been doing. So I'll introduce a little bit just to give some history. Strengthening Families has been going on in West Virginia for many years, I think, since about at least 2010. Actually, I think more like 2008. And there's been different waves of activity, and the community mini grants that we're going to hear about are the latest big push, but Jeanette will also talk about the training that's been going on. There's been a lot of training around the state They, in addition to the training, they also developed a guidebook for home visitors about how to build protective factors. Strengthening Families has been very connected with Circle of Parents in West Virginia, which has blossomed around the state. And they've been engaged on a lot of different levels. I'd say about 3 years ago, Jeanette came on as a part-time project coordinator, which has really allowed the work to bloom in a new way with that dedicated time. And Jeanette's going to share what they've been doing with mini grants in that time and maybe a little bit of the rest of the work. So Jeanette, I'll hand it off to you.
Thank you. I think there's a slide, Kaylin, that it may be before that slide. Oh, maybe not. Now go back where you were, and you did pronounce Monongalia correctly. So just to let you know, you did well.
Oh, thank you.
But I do want to share what I've been able to work with in West Virginia. I am contracted as West Virginia's first Strengthening Families Project Coordinator, and I contract through the Team for West Virginia Children. And the team is a nonprofit that has emerged as a state leader in child abuse prevention programming, advocacy training, and under the umbrella of the team we have Prevent Child Abuse West Virginia, we have Mountain State Healthy Families, Circle of Parents, and a number of other programs that really allow a lot of good collaboration statewide. The Partners in Prevention, just different, it's kind of a whole network now. So I kind of take up the real estate for Strengthening Families, and I'm able to do a lot to develop relationships and do some strategic planning with a statewide group, both around child abuse prevention and around early care and education, home visiting as well. So that is how my role really started, was really, working with folks, developing relationships. We've had a Strengthening Families website, so I work on, putting resources on that site and linking to a lot of our other partners around the state through that. Of course, with the reporting functions, I work with both CSSP, with the National Alliance, with our state funders to do that. Sharing information, I'm able to put out several times a year an e-newsletter to the folks who have taken our trainings, to our partners in these various entities around the state. And participating in the national network has been a real benefit, I think, because just like through this webinar, through the National Alliance, I've been able to look at what we can take from other states, what's been developed for the Alliance, and really kind of bring the latest and best with our trainings, with the communications, with some strategies that we're working with our other partners. So that's been really a really rewarding partnership. And in 2015, I was trained by the National Alliance, along with 3 of my statewide partners as trainers with the bringing protective factors to life in your work. And we've been training together. We're getting ready next week to put together our 2017 schedule of learning opportunities. So that has been a great opportunity to reach, over 800 people at this point in the last several years with the information about protective factors. And I would say, especially in the home visiting and certain sectors of our early childhood community, people get it. People have really embraced protective factors and incorporated those into a lot of other aspects of what they do. And then, of course, I oversee an innovative program, which is our community mini grants. So if we can move on to the next slide. And what we do with the grants is we really look at going beyond training and working with different communities on nurturing the protective factors and helping them take root. And this is just an infographic that we developed. It was inspired largely by the home visitor training that we were doing, and we drew upon the research of Charlene Harper Brown with the branching out and reaching deeper, and my co-trainers and I were kind of inspired to create this concept of when we can nurture the soil through those everyday actions, then those protective factors can grow. And so this concept has resonated well with people, and we've been working not only with our trainings but with prevention communities and with our different statewide partners to really reinforce this. And our mini grants have helped provide an opportunity for people to really take this and implement it where families are in their communities. So going on to the next slide. So our mini grants, and we talk about, you know, helping people garden for protective factors through new strategies, through maybe a little pot of money that they can do something or sustain something that they haven't done before. So we have been able to offer since 2015 grants of up to $5,000 each for organizations or community partnerships in the state to intentionally broaden, deepen, or sustain strategies to improve outcomes through the protective factors framework. And we have two categories that we have opened up applications for. The place-based grants that we've been doing since the beginning, these are projects that encourage new partnerships and take a community-based approach. So these could be programs that are leveraging other resources in the community and bringing partners together from multiple sectors. So this could be a combination of early childhood, businesses, churches, schools, health providers, early intervention, and there we go, lost my screen there for a moment. Child welfare, mental health, any combination of partners that touch the lives of children and families working toward a common purpose. And the second category we added because we were finding in some of our really under-resourced categories that sometimes families can be found and most concentrated in a child care program, in a school-based program, and you know they will still partner with others, but you know that modest amount of funding can help them to really strategically build on the everyday actions within their programs to increase protective factors. So that was what we designed it for. And the funding for this, some of you may be interested, the team has worked with the West Virginia Office of Maternal, Child, and Family Health. And the grants were made possible through combined federal funding from 3 different sources. And the Office of Maternal, Child, and Family Health has kind of carved out a little bit of money from these sources to support the mini grant program. And those are the SAMHSA Project Launch program that's being implemented in our capital city of Charleston, the Home Visitation Expansion Grant, and the Early Childhood Comprehensive Systems Grant. So my position, as well as you know, the training materials and the mini grant program, are all funded through those pots of money. So you know, we've been really blessed with a director that's been supportive of this innovation through that. And our grant terms run for just 8 months. So $5,000 in 8 months is not a lot to work with. But as you can see on the map, we've been able to fund to date, including our 3rd cycle that has just begun, we have funded 17 different initiatives. So you can see that a few of the counties have several stars on them. The one towards the top where you can see the 3 stars is Monongalia County, where West Virginia University is housed, and where that is, you know, that's one of our population centers, and there's been a lot of activity there, as well as Kanawha County, and then on the western side, Cabell County, where we've, again, both are 2 of our major cities in the state, which does not have any large cities, but those are our more urban areas. And then you can see throughout the state we've had a number of rural areas that we've funded as well. And we've actually just found out that we are anticipating funding to add 3 more mini grants on Charleston's west side in association with the Project Launch program. So we're really excited about that, and that's going to be a shorter grant cycle, but you know, it's just carrying on, hopefully, the tradition of success that we've seen with our mini grants. The next slide is just a list of the different projects that we funded. Probably doesn't mean a lot to look at them on the slide, but just kind of to remind me of what they are. There are some in red type that there's going to be a little more discussion and show and tell, including Beth Elyard's going to be able to share her project. But several of these have been, I mean, all of these are innovative. We've had different types of successes with them, and Kaylin has uploaded full descriptions of each of those on some documents that you can download from the webinar site here. So if you're interested in getting into what these look like and the descriptions and the kinds of partnerships we've seen, I would encourage you to download and take a look at that, especially if this is something that you'd like to implement in your own area. But we have had, I do want to highlight a few things about the partnerships that we've seen. A number of these have been partnerships that have incorporated family parenting support and activity kinds of events in tandem with enrichment events for the children in communities where there's not a lot of family activity available. We've had parent cafes in a couple of our communities. We've had some really, I think, unusual and really cool projects. But some of the successes that we've seen in a lot of these projects is the fact that they've been able to collaborate with more community partners to commit to working with families in a really strength-based way. We have, you know, they've been able to identify other agencies even beyond the scope of their grant application that have been working together. We've been able to see a lot of the parent cafes that have kind of bridged the gap between families and providers in some of our communities and gotten that parent voice amplified to kind of look at solutions to the struggles that our parents are facing in the really rural areas especially. We've had at least 3 of the projects that reported that they were able to leverage this small pot of funding to not only to strengthen their local partnerships, but to work with business owners and other organizations to get additional sponsorships and grants and donations to sustain the work that they're doing with families. So that's been a really wonderful finding from several of these grants. One of the projects that I did want to tell you about a few of these. One, we had a home visiting staff member in Cabell County who had received training in infant massage through a separate funding source previously. And through the mini grant fund was able to purchase the preemie and the regular sized baby massage dolls and some other learning materials and conduct a 5-week series of infant massage classes for new parents at a community center in an underserved neighborhood, as well as the county WIC office. And then after the grant ended, and she got really great response, not huge numbers, but great response from that. After that grant ended, she became a professional massage therapist, and she continues to volunteer time every week with nursing staff and recovering mothers and babies at a facility called Lily's Place in Huntington. And this is a facility that works with drug-exposed infants, and so she's working on, you know, literally hands-on with early attachment and incorporating the protective factors with families, and, you know, maybe grandparents and other caregivers who are caring for these babies as they enter the world with this, you know, real hardship, and as they transition out of the center to their families. So that's been a really unusual one. Another one that's been an unusual, well, not unusual, but I think a really effective one that just used a small amount of money, not the full $5,000, was through a elementary school in Petersburg, which is a very rural area in the northeastern part of the state. And there is a program called, through West Virginia University's Extension Office, called Energy Express. And it is a research-based summer enrichment and feeding program that goes on in different schools around West Virginia. And the grant that we were able to award last year to this Family Issues Task Force focused on providing extra training for their AmeriCorps and their college age and adult mentors to increase the social and emotional competence of the children served in the Energy Express program. So they were able to get, through pre and post testing, we're able to identify that the parents were actually able to have helping parents to foster their children's social and emotional development. And the parents kind of backed this up with comments on their surveys that their children were getting along better with their siblings, that they were, just doing better in that program, and the parents had some tools to work with. And what was exciting about that is that they can, through the success of that small project, they've gained the potential to implement that statewide with their Energy Express program. So, that was a cool thing as well. We had a Zion, a newer child development center, a very large child care center in west side of Charleston, a high poverty area, was able to do a lot of work around social and emotional support. And even though they had not completed their staff training, they saw a 20% decrease in their behavior incident reports among the children in the program, and they also saw a decrease in family turnover in their program. So, they saw a lot of promising things out of that as well. So that's some of the highlights of some of the projects that we funded. And I want to turn to a couple of other examples. If you'll go to the next slide. We had in Raleigh and Fayette counties, and again, this is a southern pair of counties centered around the city of Beckley, but a lot of, very rural, farmy, isolated areas. And their project was called Farmers Market Family Events. And what they did, this was coordinated by the local United Way, and they partnered with the maternal infant health outreach workers, the MyHealth program home visitors in their state, to, and they also worked with the local farmers markets, the extension service, and their local libraries to introduce families to the farmers markets, to provide children's books, to encourage healthy eating, and they also incorporated the protective factors into the activities they did at the farmers market. And again, they're working with very isolated, very economically disadvantaged pregnant women and families. And their goal was to get the families more connected with the community through this project. And they did have good turnout at the summer farmers market events. And they had better turnout in some places than others. And one of the one of the unexpected results or challenges that they found during this project was that a lot of the families initially did not feel comfortable shopping at the farmers markets. Not only because they didn't really feel like they belonged, but there was an assumption going in that the farmers markets would accept what's called the SNAP card in West Virginia, the food stamp benefit, essentially. And during the process of planning these events and having kind of learning from the families as they went, they realized that the farmers market vendors needed to take some steps to be able to accept the SNAP benefit. So they addressed that, and now the farmers markets have advertised this and have opened up the farmers markets for the community members who have the food assistance to be able to shop at their farmers market. So that was kind of a cool outcome that was not expected, but was kind of a side benefit of the work that they did with their mini grant. So those are just a few of the examples, and I'm going to turn it over now to Beth Elliott to talk about her mini grant from 2016 with making connections in her community. So I'll mute myself and.
Hi, this is Beth. I'm so happy to be able to talk about the mini grant opportunity. It really did help our community. We are in Morgantown, West Virginia, in Monongalia County, and the name of the grant was Connecting in Your Community. We took this opportunity to meet at the Mon County Technical Education Center with a group of English as second language students. We wanted to be able to make sure that they felt comfortable in our community, and we wanted to work on social connections and resiliency with that group. We were able to partner. Ours was a place-based grant which focused on the partnerships in the community, and we were fortunate enough to partnership with the Mountain Line, the local bus line, as well as Mon County Technical Education Center, and we're able to start small. We were able to talk with the families in the school setting and talk about how the bus system worked and places we could go, and then we started on small trips together. So it really turned out to be a wonderful opportunity to meet the families and also to see how we evolved in the community and how the community kind of evolved with us. As Jeanette mentioned, we were really fortunate. A lot of the grant providers were fortunate to receive extra funding because it seemed the more we were out in the community, the more they enjoyed helping us go even further and made everyone feel welcome. As you can see on the first slide here, this was one of our first trips. It was a small group, and we went to the Children's Museum, which is in Monongalia County. So it was an easy way to try out the bus system and that the folks feel more comfortable with the setting. So that worked out well. We did some of the events at the school by bringing speakers in, and that was helpful because I think the students felt comfortable in that setting. And then, like the next couple times, we would go out to the community. Towards the end of the period, and we were able to do more trips and more activities than we expected because of the additional funding we happened to receive along the way. But towards the end, the students actually led a very large community event, which was a swimming pool party, and it went over very well. I think everyone felt very successful. One of the things that I think has been great about this grant opportunity is it let us start on something that we weren't even sure we could do, but it helped us gain the confidence that we could build on it. And we are still meeting as families with circle of parents, in groups of circle of parents. Two of our parents, and I see the next slide went up. One of them, they're in the back there. Two of them had decided that they would be parent leaders for Circle of Parents. So they now lead a group in their community as well as coming to MTech sometimes for classes and meeting with the larger group. So it's been a great way to show support to families in our community and to learn from them. I've learned a lot, and I know the other community members have also felt very much that it's been a good experience for everyone in the community. So I'm very thankful for Strengthening Families and for Jeanette for allowing us to grow in that way and share this experience. Thanks.
Thank you, Beth. And if we'll go to the next slide, having entered our third cycle of this, we have learned some lessons, we have tweaked some things, and I think one of the really great benefits of administering the mini grant program is through the application process itself. We do require some self-assessment, and we encourage the use of the program self-assessments. So the work plans are sound, and it actually, I shouldn't say forces, but it actually gives an incentive for folks to complete, whether they complete the face-to-face training that our training team offers, or unless they use the National Alliance online modules. We really encourage people to get a good grounding in the protective factors, either during the application process or shortly, after they begin their funded cycle. So we found that, it's a great incentive to kind of get people well versed in the protective factors and actually looking at them in a real world kind of a way. We did, and I mentioned that earlier, we did expand the scope a little bit last year to include our community-based, home visiting, center-based, and family child care providers, and we have been able to fund a few of those just to provide that resource, especially in those rural communities or those underserved communities. But we have found through that still people are expanding their networks and engaging new partners, even if it's not technically what we call a place-based grant. But the majority of our grants have been the place-based grants. Another thing that we tweaked the second year is that we made I made the application process a two-step process. So rather than people just filling out a full proposal, we put out a call for submissions, and we actually asked for just a letter of intent to apply on their letterhead about three weeks before the full grant was due. That way we would know how many applications we might be looking at for our review team, but it also gave me a chance to reach out to people and provide a little more technical assistance to people who were planning to apply. And I did a webinar, was able to answer phone calls and email questions, and to send people the the program self-assessment based on what type of program they were in, and give a little bit of technical assistance around that. We found that by doing that two-step process and providing that technical assistance in between, that we got lots of stronger applications in the second and third years, that people were actually submitting strategies to build protective factors rather than just looking for a source of funding and trying to kind of shoehorn their plan into protective factor language. So we did find that allowed more support and better application. Another lesson learned during the first year, and again we were getting off the ground a little bit late because my job started a little bit into the fiscal year, I was able to do site visits towards the end of the mini grant cycle to kind of see how things went. And after that, in the second and third cycle, I actually have been doing the site visits at the very beginning of the grant cycle, again, to strategize, to kind of talk about the challenges people are having, to offer some resources for them, and again, get things off on a strong foot with the site visit at the beginning. And then doing that, we can also identify their specific training needs. And another thing, a thing that I'm trying this third year is kind of addressing the fact that in the first two grant cycles, we've asked for people to identify how they're going to evaluate their success. And everybody has come up with different measures. And this year, all of our 5 grant leadership teams have reviewed and agreed to try out a new tool that I actually learned about through this national network, which is the Parent Assessment of Protective Factors. And this was the tool that's been developed through Charlene Harper-Brown. And
yeah, I can jump into that and just say it was developed through the Quality Improvement Center on Early Childhood.
Right.
And you can find that on our website as well.
Yeah, so Vonda Kiplinger and Charlene and Dr. Brown had shared this during one of the webinars, and Lucretia Rose and I, who both have been involved in training, really liked the prospects of using this, and our grant communities have agreed to try doing a baseline and then a post-test with a population from their grant community. So we're going to try that out. So we'll be comparing apples to apples, and be happy to report back and let folks know how that worked as a measuring tool. The most common challenge that most of our communities have faced is getting parents to show up, getting parents to participate. And one of the things that I have stressed to all of our grant leaders is that you need to really work on outreach in multiple ways. Some of the lessons that we've learned about that if you have, if the parent representative, we require there to be a parent representative on every grant leadership team, and the level of involvement and engagement on every level of that parent representative, I believe, has a correlation to the success in getting parents to show up. We also have found that if a program has an existing relationship of trust with the parents in their program, that's going to give them a head start on getting a lot of parent engagement. And then we've also found that some of our most effective and well-attended activities during these grants have been promoted not only by the program leaders, but parent to parent, through word of mouth, through social media, through personal invitation. But we found that when parents get excited about it, they can help other parents get excited about it. So some of our projects may have had, all of them had success. Some of them had fewer numbers, maybe instead of 20 parents, they may have had 6 parents, and they may have grown slowly. But it does take time to develop that trust with parents, especially if they're not familiar with your program. But being able to meet parents and have the activities at a place where parents can already be found is really important. But it's also important to market and promote your activities in multiple ways to get people involved, and not to be discouraged when your numbers are not as big as you had set forth in your action plan for them to be. So that's some information about how the grants have gone. I'm just really excited about it. It's been a great opportunity, just hearing from Beth and talking to folks after the grant of how they've been able to kind of continue the progress from the mini grants with these small amounts of money. That's been very encouraging. And then I would be happy to contact or to respond to anybody who has questions about the application process, or how we've managed the scheduling and those kinds of logistical matters. I'd be happy to take any questions or follow up with anyone separately on that. But thank you all.
Thank you so much, Jeanette. I think that was really interesting, and I think it's one of the things that I find really great about it is that in a largely rural state, you're able to get some funds out into communities that don't have huge populations but obviously have needs, and even if you are serving small numbers of parents, you're making a big difference in their lives, and this size of grant is a good way to get that moving in those communities. I encourage anyone listening to type in questions or raise your hand if you'd like to comment or ask a question. I'd love to hear about whether anyone else has used mini grant processes or something similar, or just if you have any questions. One thing I'll share while we are waiting for some questions to come in, some of you know I began my Strengthening Families involvement as coordinating the effort here in Wisconsin when we were a pilot state. And one of the things that we did in those first, probably in the first year of the pilot, was to put out mini grants for early care and education centers. We had some successes in some ways with that, and some other sort of things I would have done differently. And so I'm happy to see how it's working out in West Virginia now, which is a little different than how we did it. What we did here at that time was that early care and education centers that completed a self-assessment could send in their self-assessment and an action plan and request $500 to $1,000 for an activity they would like to do within their center to implement something better than they had been or to do something new. And we had a small pot of money. We were blown away by the number of applications that came in. I think it was 120 some centers where we went from 0 having completed the self-assessment to 120 some around the state having completed it because of that small incentive. But then, of course, we did feel bad that we weren't able to fund not even most of them. But we were able to fund a nice selection of probably maybe 40 centers got these small grants, and they were able to do something. They could make a small but significant change, but we ended up feeling it was probably a little too small. We had them complete post self-assessments as well, and they showed some change, moving more towards doing the things in the self-assessment because we had given them funding to do so, but it didn't feel like quite enough of an impact. And I think with these larger, though still mini grants, you've been able to have more of an impact. And with the community-based ones, I think you get the opportunity to reach beyond the walls of particular programs, which is where we can really meet families that we otherwise wouldn't be serving. We did have one comment come in, but it was just a thank you. Very gracious, thank you. And I'm wondering if anyone else has questions or experiences they'd like to share. We've got a few minutes to go here. Okay, and I will respond. The person who said thank you also said, I hope I can get a recording. That will certainly be available. You'll get an email when we finish up, either after a day or even later this afternoon if I get it all processed in time. There's a question about whether these type of mini grants are available in all states, and this is a question from Indiana. Unfortunately, no. This is something that would be determined at the state level. So as Jeanette described, in West Virginia, they've worked with the Department of Health and Human Services to identify some funds that could be directed toward this, and that was through their state-level Strengthening Families Leadership. In Indiana, we don't have a state-level Strengthening Families Leadership group, but that I do know people are using Strengthening Families there, so there may be some people in a position with some control over funding like this where they have some discretion, that they might be able to pull out a bucket for some mini grants. But at this point, I'm not aware of them being used anywhere other than West Virginia.
Kaylin, this is Martha, and I would just share that when the Alliance was working with our Early Childhood Initiative, we used mini grants a lot, and sometimes they were very small, even $500 or $600. But as people would have an idea, and so many people out there implementing Strengthening Families have wonderful ideas, and they just needed a little bit of seed money to implement their idea. And as Beth and shared today, sometimes the reaction is more than you ever expected, and the community picks up and carries it a lot further than you even dreamed it could be. So I think it's a great strategy, and it's really wonderful to hear about the work in West Virginia today.
Great, thank you, Martha, for sharing that. And thanks again to Jeanette and to Beth for sharing so much of your experiences. I think a lot of people appreciate that, and I know I certainly do. We will, as I said, you'll get an email with the follow-up recording, and the recording and slides will be posted on the Alliance's Google site, so keep an eye out for our newsletter with those links, and enjoy the rest of your week. Thanks much for joining us.